And welcome to class. We'll get started today. I just want to thank Sylvia. She will be interpreting today. So a reminder for all of us who are either presenting or speaking, asking a question, please speak slowly so that language interpretation can happen. Again, we find it important to have language equity. That's why we're providing Spanish interpretation. And so just mind, please remain on mute. And if you would like to introduce yourself in the chat, please do so. Next slide. Just a reminder of the classroom site. If you click this QR code, you will be directed to the up-to-date information on the class. Here you can find more information about our theme for the year, creating a world of possibilities, and also more information on what the class is about and who our speakers are. Next slide. Again, we encourage you to visit the class site to learn a little bit more about these areas. Next slide. And also just some classroom reminders. I want to refer to you on that site for the land acknowledgement, any content warning. Some of these topics may be difficult to hear, and other technical information. Next slide. I have the great pleasure of introducing our speaker, Dr. Jennifer Brier. She directs and is a professor in the program in Gender and Women's Studies at UIC. She's also faculty in the History Department. She specializes in, excuse me, in U.S. sexuality and gender history, as well as public history. She is the author of Infectious Ideas, U.S. Political Response to the AIDS Crisis, published by the University of North Carolina Press. As a curator, Dr. Brier worked with Jill Austin to produce out in Chicago, the Chicago History Museum's award-winning exhibition on LGBT history. She also curated Surviving and Thriving AIDS, Politics and Culture, a traveling exhibition for the National Library of Medicine. And as of 2019, a bilingual version, both in Spanish and English, of the exhibition is touring the country. Brier is at work on a major public history project called History Moves, a community curating mobile gallery that will provide a space for community organizers and activists to share their histories with a wider audience. And with that, I give it to Jennifer to take it away. Thank you.
Thank you so much. It's so great to be here at Epidemics of Injustice. I see some people I know and some people I don't, and so I'm thrilled to be able to spend this time with you today. I'm going to switch over to PowerPoint and hope that it works. There we go. So I've been thinking a lot about how history might make us healthy. And this is a PowerPoint that I actually developed with Caesar Thompson, who's on the Epidemics of Injustice organizing team and is a public health student and a research assistant for me as an undergraduate at UIC in gender and women's studies and social justice. So he really helped to build this out. And I know he can't be here today, but hopefully his ears are burning because he knows that I'm talking good things about him. I wanted to tell you a little bit about 3 projects that I've been working on over the last, 10 or so years that are really designed to engage with non-historians. This is my cat, Ellie. She's not a historian. And with non-historians about how history can help them interpret the world and sort of understand what's going on around them and make their own experiences visible to people. And the idea of History Moves is really to think about how people can be the interpreters of history. So we live at a time where people talk a lot about telling your story and owning your story. And we talk less about the reality that part of what historians and other academics do is that they do the work of interpretation. It's sort of an extractive strategy of thinking about how you take stories and make them into history. And so what we came up with History Moves was the idea that it was possible to engage people in historical thinking, which I'm going to talk about in a little bit, and then make things collaboratively together with them. So the biggest project to date that we have done is a 3-city history that is a living women's history of HIV. So often when we think about the history of HIV, we think about men, we don't think about women. We don't often think about living, we think about dying. And so this project really takes at its center that this group of women, there are about 40 of them, have the potential to not only tell their stories, but to really change the way we understand what HIV is and what it's meant and how it's shaped our society. And I think it's important to understand that in part because we talk about living through the pandemic. And of course, we're talking there about COVID, but we've all been living through this pandemic as well. And I think it's a really important model for thinking about how you might be able to just hear people's stories. So if you scan this QR code, you can go to the website. I'm gonna switch gears now and go to the website itself and show you that. And I'll play you a little bit of sound so that you can hear some of the oral histories. Okay, so this is the website. This is the landing page. And you'll see that we actually have 4 different sections. One that allows you to read the oral history excerpts, one that allows you to listen to them. We've made some books that you can download. And then we've just recently added a section on how to teach the website, which you're welcome to explore. I'm going to go to the Here section. And one of the things that we did, and one of the things that I think is most important about oral history is that it's an opportunity to listen. We need to ask questions that make people want to talk and feel like they can speak, that they can decide not to answer any question they want, that they can decide to take a question in any direction they want. But we want to ask questions that generate lots of answers, not yes/no answers. So I'm going to play for you some of the most, for me, powerful pieces of this. Angry. It was a section where all of the women who are included in this section are talking about how HIV actually saved their life. So I'm going to play some of the oral histories for you. It'll rotate through. And you'll be able to hear it there, and then we can talk a little bit more about it.
With this disease, matter of fact, this disease saved my life.
HIV definitely saved my life. I knew enough to know I didn't want to die. You know, and that meant getting clean, getting sober. You know, I had one thing attacking my body like it was a hungry lion. You know, and then I threw drugs and alcohol in the mix, and you know, my body was like, "Girl, I'm gonna quit on you if you don't stop."
Like before I was diagnosed, I say the same thing now that I never really was happy with myself. I wasn't happy with myself and didn't know why I wasn't happy. It was like I wasn't connected. I was existing, but I was not living with myself. I was existing, I was not living. And I remember when after I suffered 2 months, I was in my house before I was diagnosed and went in the hospital. And like a breeze came to me and told me that I'm going to borrow you for a minute. And when I was in the hospital for that month, it was like I was in the hospital to introduce me, to connect with me, have feelings for myself, to find myself, to rest and find myself. And my accomplishment now is the relationship that I have with myself. That I don't have to be in a relationship with a man. I'm in a relationship with myself.
There you go.
So these, sorry, the screen share is in a very bad place. And now I can't new share. Sorry, there we go. So the work is really to make space for people to talk about their own experiences and then to connect them together and take on that power, that interpretive power. So that's what History Moves has done. So we've done it with this group of women living with HIV. We did it with a group of young people living on the south side of Chicago, where we spent one summer with them thinking about learning how to do oral history and archival historical research. And the second summer we spent together with them thinking about how to speculate about the future, given what they have learned about the past. And then in the project where I first met Caesar, we did a project with the citizen scientists, which is another cohort of people that some of you may also be, which is in conjunction with the School of Public Health. And the idea of this project was to work with people from the Citizen Scientist Corps and people from the Odyssey Project, which is the free college tuition for up to 11 credits in the humanities offered by Illinois Humanities. And there's one in Spanish and in English. And so if anybody in this class is interested, I'll post to the chat the information. It's sign up time for that. It's coming through and UIC grants those credits. And the classes are offered in Spanish and in English to study humanities, sort of writ large. So the Chicago History Corps was really to create a history, an oral history of the year 2020. And the citizen scientists and the Odyssey students did oral histories with the people who I like to call the mayors of their block, the unsung heroes of their block. And they produced these amazing posters and images. The yellow one here is of butterflies, obviously has real meaning in both in Chicago, but also in a range of migrant spaces. Butterflies travel freely in the Americas. That poster was made by Caesar. There was another person who interviewed people who had their water shut off during COVID. So they made this drawing with the water dropping out of the taps with dollar signs on it. And other people talked about how they grew and the kinds of things that happened when they were all sort of closed off with COVID. So it was just another way of thinking about how oral history can be part of communities and neighbors and organizers and activists to sort of create their own history that they can then use to continue to organize and continue to make change. The last project that I'll talk about is a sort of teeing up for next week. is a project that is about, that is a living history of long COVID. And that project is called Listening for the Long Haul. And Jackie, who's on the call today, is going to be running the session next week, talking about her experience in the Listening for the Long Haul project, which is, in essence, really the fourth project that we've done as a group. And it's an exciting one, and I know she's excited to talk about it, and I'm excited to hear her share her experiences with it. So what I thought we would do now, but maybe I'll take a small moment to just see if there are any questions before we move on to the next part of the conversation. And also to check in and make sure that my speed is okay for the translation.
Thank you. Yes.
Okay. I can't tell if there are questions because my screen is filled with all of this other stuff. So just let me know if things come up. Katie, Emily, Yvette. So what I wanted to do, and this is really what I do in all of the History Moves projects, and actually increasingly something that I do in the history classes that I teach at UIC that are often across campus on the east side, is I've spent a lot of time working with this document that I sent out to everyone to look at. And if you didn't get a chance to look at it, you can scan this QR code and go to it. It's an article written by a group of historians who are people who think a lot about how to teach history to high school and college students. And they have come up with this idea that there are 5 C's of history. And the reason I think that this is a really powerful tool, and I'll go through what all of them are, is that so often, I think that this is true, people think that either history is something that only historians can do, that it has to be about things that went in a certain order, facts that happened over time. And really what I believe thinking historically can do for all of us, whether we are done with history after high school, or maybe we really like to read historical fiction, or maybe we like to watch Finding Your Roots on WTTW or whatever it might be, or maybe it is that you have a regular family reunion and you talk about your history. That thinking historically is really a way of understanding the past and a way of contextualizing and figuring out what has happened in the past, and it also can help us understand what's happening in the present. So this is really, for me, why it's exciting to think historically. And let's take a look now at what those 5 C's are. And I will ask people to come off mute if they are able to contribute to the conversation. So the first C is change over time. So I think sometimes we think that history's only happened in the past, and it's true that history is in the past, but the past could be yesterday. It doesn't have to be a long time ago, and we're looking at the way things change. So these are 2 different maps of Chicago. The one on the left that's blue is a map from 1812. And you see Lake Michigan here on the farthest right-hand side, and you see other bodies of water and lakes, and this at the lower half says Mud Lake, right? This is before the founding of the city of Chicago in 1837. This is the land of the land acknowledgement. This map is the land of the land acknowledgement. This is the unceded land of the Three Fires Confederacy. That's what we're seeing here. And then if you look on the right at this black and white map of Chicagoland, it starts to look more like what you might imagine a map today would look like. This is from the 60s. And you see it has the 1960 census in this lower corner on the left-hand side. And then maybe the other map that many of you might know is that map of neighborhoods, the 77 neighborhoods. And there are some funny ones that sort of call out different neighborhoods for being different things. But in essence, historians are interested in how these ideas evolve over time. And it's really something that we can see in lots of different places. So we can see maybe the most obvious one that's in your phone is just looking at photographs from 10 years ago, or when Facebook pulls up your memories from 6 years ago, you can look at how different your hair looks. And that might be a way to see it, or how many more wrinkles you have. I'm talking for myself, of course. Another C is about context. And I think that this is a really important one. I'm not going to play this whole piece. You can listen to it at another time if you want. But it's really the idea that partially what we are all capable of doing is taking these facts and giving them a context. So this is about a particular song, which some of you may know. I'm not quite sure how old everybody is here, but this is a song that was made popular in the 60s, and it's very much about what was happening in Chicago in 1968. It's about rebellion. It's about dancing is a metaphor for taking it to the streets. And I think it's important to understand that the way we tell stories about things that have happened in the past are really contextualizing and helping us understand history. It's helping us think historically. So change over time, context.
This summer, NPR launched a series on songs we know
we're not
that
gonna
have
hear you
become
right
American
now.
anthems.
Thoughts, Simon?
Think now of summer.
So the last three C's really go together, and they are in some ways harder to hold, but I think really important. So they are causality, what causes something to happen, what is the relationship between cause and effect. Contingency, meaning that there are lots of ways that things could go. Nothing is inevitable. And if we resist the inevitableness of ideas, we are really thinking historically, because we know that things are contingent. They change directions at different times and shift. And then the one that is perhaps the easiest to understand, complexity. Nothing is simple. Nothing is just one note. Nothing is just, there's not a simple explanation for things. So this question, which is a deeply historical question, what made Chicago one of the most segregated cities in the United States? There are a lot of ways that you could answer that question. And in public health, you answer that question, or public health scholars answer that question in a lot of different ways. Historians answer it by thinking about, one, the change over time that we're talking about. Are we looking at a map of the black-white line moving south and west? Are we looking at where Mexican and Puerto Rican migrants arrive in the 1930s, 1940s, 1950s, and how segregation gets stitched in over time? Are we thinking about what it means to talk about context? That is, to understand that there's something called the Black migration. That means that people, formerly enslaved people or their immediate descendants, are leaving the US South and coming to the North. Are we thinking about what was the cause of this segregation? So was it about migration? Was it about white fears of what things should look like? And so I think that these kinds of things you see on this map here on the right, that there are areas with racial covenants, which means that there are areas where there are strict rules about who can live where. And of course, there's one right around Midway in Garfield Ridge. There's one, very much on the south side. This is the Black Belt where it says areas with racial covenants. And then on the left, you see these protesters basically saying it's up to you to end segregation. There is a way to change the inevitability of this. It doesn't have to look like this. Does it mean that they succeed? Not necessarily, but it does mean that there is a kind of agitation and complexity that we have to understand. So here it just is again to sort of say, what happens when we examine multiple causes of racial segregation in Chicago. And here with contingency, to say what made Chicago one of the most racially segregated cities is that it wasn't inevitable. It wasn't just because large numbers of people came to the city at the crossroads of America. It was produced by local and federal policies. It was produced by bank lenders. It was produced by employers who paid different wages to different people. It was produced by neighborhoods that decided that they wanted to have rules that kept Black people from living in the neighborhood, and then the distinctions between people who were renters and people who were homeowners. None of this is inevitable. It's produced by people in the past. And then complexity. And this is really where I think the oral history work lends itself in some of the most beautiful ways. And I hope that you heard that in the women's stories that I started the evening with. What happens when we ask people who live in Black and brown neighborhoods what it's like, and we actually listen to what they say about how their neighborhood came to be? We'll hear about waves of disinvestment. We'll hear about their neighbors who changed fully the course of things when it seemed like they were not going to be able to do so. We'll be able to find all of those things. And that is really what I think a group of people, so this Zoom has 60 people on it. What would it look like for us all to make a commitment to talking with our neighbors about the things that matter in our neighborhood and thinking about that in relationship to public health? So I want to take the 3-minute break that I know we're meant to have. I think is that a good idea, Emily, or should I keep going and finish this last section? When do you like to take your 3-minute break?
We usually do it about an hour in. So
Oh, okay.
I think you're good for now.
So I'm good for now. So could I ask, how do these 5 C's sort of, where do they land with you on the Zoom? I'm gonna stop this Zoom for a second and see where they land with you. What do you make of these 5 C's? Oh, they're messages. Oh, Dr. Ford, do you want to come off and say something?
Yes. Hi, Jenny. How are you?
Hi, Tiffany.
Dr. Brier. So yeah, I was staying on mute because I'm sick, so my voice is a little messy. But, we had an action lab was it last week? Well, actually, I led the action lab, and it was on public writing, and we were talking about some of the key components, some of the key aspects that we need to consider when we're doing our public writing and really sharing information. Freely available information with the public. And these 5 C's really, like, I can't help but think of them in the context of public writing and think about like, you know, how might these 5 C's shape the sort of messages that we want to write and share, the sort of evidence that we feel is important to bring together to communicate the point. So I really appreciated the slide about like the contingency, thinking about like policy and what it looks like to share messaging about like policy histories and things like that. So that was what was on my mind when I was
Great.
listening to your presentation.
That's great. Thanks for that. Anyone want to add to this? Okay, should I read these? Julian and Stephanie, would that be good? Julian says, I've heard of it before, changes my conception on history, a recognition that events are shaped by decisions made in the moment, not quite fatalism. Yeah. One of the things that I often do when I have a bit more time is before I introduce the 5 C's, I just ask people to put into the chat like what history means to them. What does history, what do you think about when you hear the word history, or when you heard that a historian was coming to your Epidemics of Injustice class? It is a deeply historical class in many ways, but I often think that that's one to do it. Stephanie says, I can't come off mute, but my first thought is how different the 4 C's, 5 C's are compared to how public health traditionally analyzes issues. I wish you could come off mute, Stephanie, and say more, but maybe one of your peers could chime in on that. Yes, I can, Kat. Let's see first if we get any people.
Well, I'll just come off. I'll just add to maybe what Steph is getting at by saying that, you know, I think public health and some other fields as well sometimes do present information in a sort of ahistorical context, which also can sometimes mean that we don't have all of the adequate information to understand the root causes of the information that we're actually presenting at the point in time, which, I mean, to what you said earlier, Dr. Brier, like that really is the reason for a class like Epidemics of Injustice.
Yeah.
We saw a need for a class that would allow us the opportunity to have conversations about history and how it brought us to the inequities that we find ourselves discussing in the classroom. But, you know, we don't tend to have access to like public health history classes that really provide us with all of that necessary context to really understand the waters that we're currently swimming in.
Right. So Howard Walensky says, we started off the first session with Dr. Murray saying there is an absence of historical content and context in public health. I would agree completely. So that's super useful. And it looks like Steph felt super seen by what you just said, Tiffany. So thank you for that. It is a really, I would say, though, to also add that just as public health doesn't necessarily have history or doesn't necessarily provide a kind of historical analysis of itself, I think sometimes it's also that public health is deeply, for a lot of reasons, and it's not exclusive, but I think it's true, still is deeply committed to a kind of quantifiable, a particular kind of evidence. And part of what I find really important about history is that it has different models for thinking about how we understand what has happened and why. And I think that actually gets to Kat's question, which is, can you explain the difference between causality and contingency again? And there is an important distinction between those two words. So causality is understanding what, if we say that A caused B. So in the case of COVID, that in being infected with SARS-CoV-2 caused the body to experience something called COVID. And then what you'll hear about next week is, and then a percentage of people we know also are living with long COVID. So those are causes, right? And there might be questions, at least at the beginning, there were questions like, we don't know what this is. We don't know what is causing people to be sick. And then we found SARS-CoV-2, and we still don't know we don't have enough information about what caused long COVID. We just know that long COVID exists right now. And Jackie will talk more about that next class. So public health is very interested in causality. Public health is very interested, and it's in fact stitched into the way that public health works. You look for especially when you're thinking about an epidemic or a pandemic, you look for the root cause of something, you look for the index case, you look for the first, and then you think about how it spreads. That's what epidemiology is. So epidemiology is a study of cause. Contingency is the idea that things are not inevitable, meaning it's not inevitable that it wasn't inevitable that at the start of the COVID-19 pandemic that we would have the kind of inability to talk about risk and to talk about the effects at the societal level, and therefore different states had entirely different experiences, different cities. And we know quite well that the racial disparities of COVID-19 and subsequently long COVID were entirely contingent. They weren't inevitable. They might have been predictable, but they weren't inevitable. So actions had to happen, policies had to be put in place that made those things become a reality. They weren't necessarily going to happen that way. Janice, please, do you want to add to this?
I'm okay. How do I phrase this? You brought up the Great Migration,
Mm-hmm.
and in a public health framework, we constantly look at lessons learned. We digest, we
Yes.
debrief so that we don't repeat the same mistakes, right?
Mm-hmm.
So if we look at the migration of our neighbors to the south of our borders, as they are entering, especially those who are being transported from the southern region into our northern states,
Yep.
we are repeating some of the same mistakes that we are still paying for when we closely examine causality.
Yep.
I'm going to use this as one example, the disproportionate crime that we often see in our Black families. When we look at the disproportionate breakup of Black families because of the systems that were put in place as Black people migrated,
Mm-hmm.
citizens of the United States
Mm-hmm.
moved from the South to the North for jobs,
Yep.
for opportunity. Okay, so now we have again our neighbors to the South coming in, and we're repeating the mistakes. For example, I read recently that with the shelters, they're only allowing the women and the children to come in. And some of the fathers, the husbands, are actually creating camps outside the shelters. Yep. Because they don't want to be separated from their family. The same thing happened with Black families.
Yep.
When we got here, our ancestors got here, and there were no jobs.
Yep.
Primarily because of discrimination.
Mm-hmm.
Okay, white people did not want to hire Black people.
Correct.
And the only way a family could survive in some instances was if they received some kind of government support, similar to what migrants are receiving now. But the only way the mothers could receive help to keep their children from starving was that they had to move their husbands out of the home.
Mhm.
And then we got these horrific habits where some Black men decided, okay, I don't have to be there. The government's going to pitch in, and it created this chasm of sorts for what made for what used to be a very close-knit family. Now we are doing it to migrants coming from the South. So where does this cycle end?
Well, that is a very astute set of observations, and a deeply historical one, Janice. And I think these are fundamental questions that that history can at least help us contextualize. I kept thinking when you were talking about a historical example that I use to teach my students, which is Johnny Tillman, who was one of the most important welfare rights activists, a Black woman fighting in the 60s for welfare reform, says, when you go on welfare, you trade a man for the man. And it's a real, there's a deeply important conversation about gender history stitched into what you were talking about. There's a deeply important conversation about geopolitical history, because of course it's not only people from the Americas who are crossing the southern border. We know that it is significant numbers of Asians. We know that it's significant numbers of Haitians. We know that it's significant numbers of people from sub-Saharan Africa. It's a much different kind of migration than I think we know in a lot of ways. But we also know that borders are historical as well. And part of what you're asking is, and part of what public health asks, and part of what I think some of the best history asks is, how do we not repeat these patterns? What is it that we have to change for us to be able to get to a different outcome? Because otherwise we're just repeating the same thing and expecting something different. And we know that that's the definition of insanity. Tiffany, please.
Yeah, I wanted to also react to what Janice just said, because I feel like that reflection, and even in your response, Dr. Brier, it makes me think of the issues with the silos that exist in academia. Yes. Because oftentimes questions that are being explored and answered in some fields, the answers are needed in a whole other discipline, but they're not communicating, they're not, they're not working together, they're not talking with each other in their publications and things like that. And so we're not learning those lessons. So Janice, you're right. Yeah, we should have been learned how to navigate the everything that we're dealing with today. But here we are because, probably someone explored this and they came to some really clear, conclusions and potentially recommendations for how to go forward. But that wasn't in the book that the people who make the rules were reading. You know what I mean? And so I don't know. I think about this a lot as an interdisciplinary, and really I refer to myself as transdisciplinary sometimes, researcher, because we miss so much by trying to remain in our silos, and it really is all connected, like you pointed out, Janice.
It's so true. And it's funny because Jenny Hebert Byrne and I have, first of all, people confuse us because we're both Jennies. And so I'm Jenny B and she's Jenny HB. And she says, oh, public health has everything in it. And I'm like, well, that's how I feel about history. So maybe we should try to bring them together and see what happens. But let me use that as I just want to I want to make sure that no one else has a question. Priya says in medicine, if we don't have a historical context, then we make public health mistakes, like currently the measles outbreak, right? So I believe it is imperative to have a where it started, where it's going situation to avoid these scenarios. And then Stephanie said, I also think about what it would look like for community health needs assessment to adopt the methods for understanding root causes. So let's take up that challenge that Stephanie has put down and think about oral history and where oral history can live in a community health needs assessment, in the way we understand what's going on around us, in the way that we amplify and listen to what people are saying their lived experience is. And it's a mechanism to try and do that. So let me go back to my screen share. And I will show you this. I don't totally know why Caesar, oh, I know why he chose this photo. It's a sort of strange photo. It doesn't really matter. I'll show you where it came from in a second. So oral history is really a process of interviewing someone about their life. And it can be very specific, like it can be about a specific event or a specific set of things that have happened to them. It can also be from start to finish of their life. So I say this because my mom, who worked in public health for all of her career, and ran Bellevue Hospital in New York City, and worked for the Health and Hospitals Corporation in New York City, which is basically the equivalent of Cook County, has just been sitting for oral histories to try and help her get her historical memory in place. She sat for 13 interviews. So I'm not suggesting that we all should do that, because that's a lot and not everybody can do that. But it is possible to have a conversation with someone and to ask questions that can allow them to unlock their memories and their stories about the past. And we can be active listeners of that, and we can make space for them at the same time that we also are engaging with them and trying to hear what they have to say. So it can happen over Zoom, it can happen in person, you can record it on your phone, you can try it at the dinner table if that's possible, and you can sit down and be not a talker, but a listener. And it really will allow us to find out what people are experiencing. So this is, these are, oh, here she, oh no, don't go away, Helen. Hold on, I forgot that you were there. Go back, go back, go back. Sorry, technical difficulties. Hold on. Come on, sorry. Okay, no.
A vice president of one of the large coal operations once said to me that he had two responsibilities. One was to get the coal out of the ground as cheaply and efficiently as he could, and the other was to make a profit for the stockholders. When it came to any of the other responsibilities relating to the community or the environment or people, that was not his responsibility. That was not his mission. That is really the basic principle of our economic system, whereby profit motive is really important. And if you don't make a profit on something, you don't do it. And you do everything you can to make a profit, which is cutting corners and so forth. This may work all right if you're inventing something or producing something that is not damaging to either the environment or the people, but when you are dealing with natural resources, which are very essential to the welfare of the whole country and to the people who live in the area, then it can be devastating. All the kind of social costs then are left for somebody else to bear, the taxpayers to bear, the citizens to bear, and are not counted into the cost of production.
So that is an oral history with an environmentalist named Helen Lewis, and that was obviously done in the 70s. Caesar took a class with me where we read a book that I will also pull up that is open source. And so if you're feeling excited about history and oral history in particular, you'll be able to look at it. Why are you not letting me stop the share? No.
A vice
Sorry,
president
sorry.
of one of the large
No,
coal
no,
operators.
no. Sorry. Okay. There we go. So this is a book. I'm sorry about that. It's so hard to do because I'm working on 2 different screens and I get confused. It's this book, and maybe you all can put it into the chat for me, Emily and or Yvette. So it's called Radical Roots, Public History and a Tradition of Social Justice Activism. And there's a whole section on oral history. And one of the chapters that Caesar got really excited about was this chapter on Helen Lewis. And so what's nice about the public history about this book is that you can listen to the oral history. It's embedded inside of the book. So as you read it, you can listen. But what I think is really important about the Helen Lewis is that you can see that you're getting her, both her expertise, but also in her own cadence, you're hearing what it sounds like for her to be talking to you and not just reading it in paper. And I think that can really matter. So let me go back to the PowerPoint and I will do this. Okay, that'll be the last time I do this because otherwise it'll just be too weird. Okay. So some important things to think about when doing oral history, and then I'll end with a website, and if we have a minute, I'll play one more piece for you. So obviously interviewing someone requires obtaining their consent. And I say that at the most obvious level, but also I think it's really important, and this is part of what I do, to have an ongoing discussion about consent with the person who agrees to sit for an interview. That might include, and maybe Jackie will talk some more about this in the next class, that might include at the very least saying that you don't have to answer any question you don't want to. It may include making sure that you have the questions ready for someone to look at before they come to the interview. It may include, saying to someone, you can do this interview and we'll transcribe it, and then you can decide if you want parts of it to just be for you or parts of it to be shared out with the world. You have the narrator, as we call them in oral history, has control over what they want to share and how they want to share it. The other thing that is required of us as interviewers, as people who are budding oral historians, is to learn how to be active listeners. So sometimes that means nodding your head and saying mm-hmm, and trying to make the person read the cue that you are listening. Sometimes it means taking notes and just being able to ask a follow-up question that is deeply related to what the person has just said. And it also means that you sort of acknowledge that you, as the interviewer, have some control over the interview. You want to make it possible for the narrator to tell stories, but you also want to be able to help direct them or bring them back to the subject at hand. And I think the last one that is really important is that you want to encourage people to move beyond the everyday. The other way I often like to think about that is, I don't know if you if this will make sense to you. But I feel like people have scripts. Like I have scripts that I tell, like I have a story that I'll tell. If someone asks me this kind of question, I'll tell that kind of answer. And part of what a good oral history can do is to get you off your script, to get you off of what you say all the time in answer to a question. And it might be about the way you think about yourself in relationship to your family, or as a neighbor, or what you are as a parent, or whatever it is, to sort of get off of that everyday script. The last website that I want you to know is yours for the using is the Samuel Proctor, which is out of the University of Florida. I don't know how much longer it's going to be in existence, given what's happening in at the University of Florida right now. But the Samuel Proctor Oral History Program has some really simple steps to doing oral history that all of you, if you're interested in doing it, should take a look at, take a listen to. All right, that's an hour. I could play one more clip, or we could take a break. What do the organizers wish for me to do?
How long is the clip?
I think it's like 3 minutes.
Okay, yeah, let's do the clip and then we can take a break.
So this is Helen Lewis again, and this was when she did. So the first clip that you saw was a film that she had been a part of from the 70s. And this is the oral history of her remembering back to that moment. So just, it's a little meta, but the first one was the example of her talking about something as it was happening in the 1970s. And this one is an interview that she sat for, I think, in the early 2000s.
Because your health program is good there. Everybody gets health care. So there's a lot to be learned about how to maintain communities and maintain people's health and well-being and quality of life, even without some big factory coming in. So that we still hope for the big factory to come. Toyota's going to come save us, or somebody's going to come save us. And we've got to create our own jobs and create our own communities and take care of each other. And you need government to help do that. And we have just getting to the point where we don't want government to do anything. So we've got real problems of that sense. Because now some of that is happening in Britain. So they're kind of following, I mean, maybe this is a world trend that we have used up all our resources in the world. So it's a global problem. It's not just coalfield problem. So but unless we learn from each other and accept the global relationships and understand, and I mean, we need to do that. So,
well, that may be just a perfect way to end the show. Did I stop the screen share? There we go. Okay. So I'm
Thank you so much,
happy
Dr.
to
Brier.
take some questions, whatever people want. So Chil said testimonials or testimonio are such a great way to collectively process difficult circumstances and serve as a vehicle for mobilizing communities. For this reason, I love spoken word art and story slams. Absolutely. I would love, so Chil, if you want to come off mute and talk about what you think the difference is between testimonios and oral history might be, or maybe you don't think there's a difference.
Can I actually pause us? I think we're going to take a 3-minute break to give everyone a chance to gather their thoughts, for their interpreter to catch a drink of water. So we're going to come back at 6:37, if that's all right.
Okay.
Of creating community, in terms of folks finding, or stories resonating with people. And the context in which I've heard most testimonials given is in spaces in which gender-based violence is being discussed. And so in that sense, each testimony given is very different, but also the same in the sense that it's an experience that many people have lived, and so there's like solidarity and kind of a unity that's created from hearing them.
Yeah, I mean, there's so much in what you've just said. This point about in both testimonios and oral history, you are hearing about one person's perspective. And I think in both cases, there is very much an organizing, especially for testimonials, there's an organizing strategy there, which is like bringing people in to a kind of witness space to help hold space for you. But it is very much about the about how you sort of piece together these different quote unquote subjective experiences. I would call them lived experiences, to piece together a larger context. But I think that is very true. And there are a lot of scholars at UIC and all over the country who write about testimonios. Many of them are in gender and women's studies with me. So Elena Gutierrez is a sociologist by training. She's written about sterilization abuse of Mexican origin women and is working on a project on Chicana Chicago, sort of thinking about Chicana organizing and activism here. And then Esther Diaz Martin, who is a faculty member also in gender and women's studies and Latin American Latino studies, who does work on borderlands podcasters, women podcasters. And so she's very interested in the sound of oral history and testimonials, what it sounds like to listen to it as opposed to reading it. And I think that that idea of what happens when testimonials or oral histories are used to call people in is a really important piece. I'm glad to see that, Steph.
Thank you. I have a question from Julian at 6:35 p.m.
Great.
Would interviews like on 60 Minutes be an example of oral history?
Well, there's certainly an example of doing an interview that is historical. I would say that journalists tend to do interviews that are much more targeted and aren't so open-ended. So that would be the difference that I would make. Not that it's not historical testimony that someone is in essence giving when they're interviewed on something like 60 Minutes, but that's for a very specific purpose, a purpose that's already been decided, right? It's going to be a piece about this. They found this expert or this person who's experienced something, and then they take from it. I think oral histories tend to be, when they're at their best, they're broader than that. Does that make sense?
Yeah, I guess you kind of answered my follow-up question. The root of it was really what's the difference between an interview and an oral history, and it sounds like it kind of rests upon whether or not the questions are open-ended, closed-ended. What are the goals of the interaction?
Yeah, I mean, there's an oral historian who has written a really important book that lots of people love to hate and hate to love. And he argues that an oral history is always a process of shared authority. So it's produced by two people. The work that I do is actually three people, but that's, that's sort of details in the margins at some level. And it is a shared authority. It is something where someone is asking questions and listening to the answers, and someone is primarily giving answers that aren't destined for some place necessarily. Oral histories are a type of interviews. This is what Dr. Ford says. Oral histories are a type of interview, but not all interviews are oral histories. Yeah, I would agree with that.
Thank you. We have another question from Venus at 6:39. She says, I may have missed this, but how do you prepare oral interviews for presentation? I feel like attention span is a big issue. So how do you make sure it has the most impact?
What a great question. Well, the way I've done it is I do try to keep things short. So if you have a chance to go back to the Living Women's History of HIV that is shared, the website I showed you, and I played you some of those clips, and the link to it is in the chat. It's stillsurviving.net. We really tried, precisely because of your we understood your question in many ways, Venus, those clips are very short and they are conversational. So those clips came from the women interviewing one another, and they were in a kind of dialogue, and so we've kept it that way in that space. And that is partially because it's hard to get people to listen to something for longer than 90 seconds. But also because we wanted you to be able to experience the hearing of it and not just get the information from it. So not just know something after you listen to it, but to experience the hearing of it and to hear the emotion in it. So I think that's part of how we've tried to do it. And I think there are other ways that people have tried to do it. Yeah, Tambra, did I say that right?
Yes, you did. And thank you very much. I love history and I think you're awesome. But I am struggling here because being myself in public health and the things, and of course, everybody know from being CDC, we have done a lot of damage. So we start talking about history, and I got several things. How do you take, and so we don't do these things again. A lot of times I don't hear where people are afraid, right? We don't want to have those uncomfortable conversations. So even if we do an oral history, that's my perspective. So I have to be open-minded enough to say, I really want to hear this.
Yeah.
And the other thing is when we looking at, and I've said several times, was it Dr. Janice that was there about the immigrants now that's coming in, going through the same thing that Black Americans went through. The exact same thing, but it's almost like we don't share that history. It's almost like it's not the same, and we keep repeating the same thing over and over again.
Yeah.
So I mean, I'm like really struggling to see how we get to a solution, because you made a point to say epidemiology is looking at root cause, which I tend to disagree. I think we do surveillances and we look at it and we just list it down, but we never get to the root cause.
Yeah. Well, those are not easy questions.
I know, I'm always a complex person. Ask Dr. Ford.
Yes, well, I see that. Dr. Ford has already testified to that in the chat. And Janice added another interesting and I think really critical question, which is where do you draw the line with exploitation in interviews? Meaning like, this has to be done freely, and people have to have control over what happens with what they say. So anything that I've played for you has been cleared to be shared. And in fact, what we did in the Living Women's History of HIV project is we transcribed all of the interviews and gave the transcriptions back to the narrators, and then we read them together. Sometimes I read them back to women because I was able to read more effectively than they were. And we asked them to mark the transcripts with the things that they never wanted shared the things that they were fine with sharing, and most importantly, to mark the transcript with the things that had to be shared. So we structured it that way, for one, because we're well aware that exploitation is real, and part of what you see in like some of these journalist endeavors is like that gotcha moment. Like, we're not trying to catch people. We're not trying to, and we're also not trying to get people to describe hardship in a way that is about something performative. And so we spend a lot of time talking about that together, and we in the end come to a place where they are very clear about where it's going. They are very clear what it's being used for in this case, and we don't in fact share things if they don't want them to be shared. So all of these, like, there are parts of the interviews that you will never hear and that I will not talk about. So that is the ethical consideration that I think we very much need to hold if we are going to think about oral history as a strategy. So, but the question about how do we not repeat ourselves is partially, I mean, I don't know how policymakers take up history, and I think it goes partially to Dr. Ford's point before, is that maybe in public health, we need to have more historical observation, and maybe in public policy, we need to have more historical observation. I was just on a call this morning with one of my colleagues from the law school, and we were talking about how law students do and do not learn how to think historically. So maybe it's something about so to go back to my original question, like, can history help make us healthy? I think there are some ways to do it, but we have to be willing to sort of have very difficult conversations and be willing to change the way we're moving forward on some things. This is, it's hard to do. How you make change is hard. Historians typically study change. We don't always think about how we make change. But I think that even if we think about how people talk currently about this thing called narrative change, that is, telling stories can yield change, it can have policy implications, I think doing historical work can make change. Public health framework is often based on tradition of public health practice, not social justice. I would agree completely, Janice.
Thank you. Are there any others? If not, we all want to thank you for this wonderful discussion, wonderful talk. Thank you everyone who shared and for being here.
Thank you so much for having me, and thank you for translating and for welcoming me. This class is an amazing opportunity to be able to be in conversation with all of you.
Thank you. Just some quick updates for the course. Next week from 7 to 8, we will have Stuart, who is the Associate Director of Academic Services, join us. He will talk about the MPH program. So if you're a community member interested in joining E of I, or if you consider doing continuing education, please come and learn a little bit more about if public health is a good fit for you. You can ask some questions around the curriculum, career pathways, requirements for admission and application, and there's open time for discussion or any questions that you may have. Next slide. And another reminder is on March 21st, there will be no class. The students are on break. And on the 28th, the class will only be those for credit. If you're looking to engage during those 2 weeks that we're off, please feel free to explore the website, past lecture recordings, send us some questions that you may have, address the data dictionary. But if you want some other ideas, please feel free to reach out to us. And as for the students that are joining, we will start up at 7:05. Thank you.
And I'm excited to hear Jackie talk next week.
Yeah.
So maybe if you'll let me, I'll come back and join.
Oh, you're welcome to come. Sorry, I was gonna mention that Jacqueline Luciano is coming to talk with us next week, and so that'll be an action lab that will kind of help us situate some of these ideas that we had today, and so come prepared with some of the engagement of what we learned today for the action lab as well. So please join us next week. And again, for the community members, feel free to stay. This is your space where you all can talk. And as for the students, we will see you in 10 minutes in the group. Thank you.